Think you're protecting your knees? Think again. You might be making these 7 mistakes that are secretly wearing down your joints, leading to pain, stiffness, even long-term damage. I'm Dr. Tammy Penhollow of Precision Regenerative Medicine. As a joint and spine expert specializing in regenerative medicine, I'll break down what you need to stop doing right now to keep your knees strong and pain-free. Let's get started. Oh, and stick around for that last one. It's a real joint killer. So we're going to talk about 7 things that you may be doing right now, thinking that you're helping yourself. You're out there lifting weights, you're in the gym, you're doing certain exercises, but is it the right thing? We've got to think about what happens when people have knee osteoarthritis, or they've got damage from a torn meniscus or a strained ligament, or they're post-op and they're rehabilitating. So here's the deal. Number 1, there do need to be some activity modifications. The number one reason that we do things like tear the medial meniscus or have a medial collateral ligament damage is a twisting with a planted foot. Imagine accidentally you step down off a curb, you do a quick pivot, and that's where you put some stress on that medial aspect of the knee right here. As you do that twist this way, we can tear the meniscus, which sits right in here. We can strain the collateral ligament, which sits right here. So that twisting on a planted foot, very, very common, could even happen technically when you're not super weight bearing. Like you don't have to be running and then step off of a curb or stepping on a cobblestone or a pebble or something. It could be that you are in a forward motion and you were struck from the side, which causes a gapping of this joint here and can cause some damage. So if you are involved in twisting sports and planting sports, things that cause lateral movement, you're not just going forward. Let's think pickleball. Let's think golf. You know, when you're driving from the tee box in a golf maneuver, that is twisting on a planted foot. When you're playing pickleball, you are moving from side to side to go to get that lob, to reach in to do a little dink over the net. So all of those things mean that you need to have some strength around the area. So it's not just the fact that you can't do anything where you're twisting on a planted foot. It means that you need to have the right footwear. For example, court shoes for pickleballers, having the right footwear, basketball shoes with higher tops for all that ankle translation. You also need to have stabilization of the muscles and strong muscles. And that's going to decrease the stress when you do that planting and twisting. Number 2, doing heavy squats and having poor form. You've all seen somebody at the gym. I'll just pick on the guy who's got this huge weight on his shoulders and he looks really muscled and well built, but he's doing some very poor form where maybe he's not sticking the butt out. Maybe he's got a big, huge arch in the back. That technique matters. It's ideal if you have somebody assess. Find a trainer at the gym. Find somebody who will very specifically, not Joe Schmo who's just been reading a muscle magazine, but somebody who can dive in on your form. Make sure that the toes and knees and hips are in alignment. Make sure that you're breathing correctly with the squats, etc. Squats can be fantastic for building muscles, and I tout them for building that quad strength, which then decreases your risk of losing muscle mass as you age. It combats sarcopenia, the fancy term for that. It also helps stabilize the knee by having the muscles above and the muscles below, because it involves the calves, it involves the shins, it involves the quads and the hamstrings when you are doing squats. You just have to do good form. Number 3, no rehab after you have an injury. Say you do twist, say you get a pop, say you get some kind of a ouch in your knee, and you decide, okay, I'm going to take some time off. I'm going to rest. I'm going to put some ice on it. I might put some ACE wrap on it. Well, then that becomes a couple days, and it becomes a couple weeks, and it becomes a month. And by that time, we've moved into, you guessed it, sarcopenia, muscle wasting. It only takes a healthy male 5 days of inactivity before we start to see significant muscle loss. And if you've had something like a surgery, say you've had a knee replacement, say you've had an ACL repair, say you've had that, and I'm sure that they put you into a rehab program, but say you've just been so painful, you've said, this is not working for me, I've got to rest more. Well, you also need to fight the weakness. You've got to fight the tightness of the muscles. You've got to correct that mechanical issue. Say it wasn't as important as a surgery. You didn't have to have that. But say that you got this nagging thing on that outside of your knee, your IT band is not happy. Well, why is the IT band not happy? Is it that we are not stretching appropriately? Is it that when you strike with your heel, you're getting translation all the way up in because you're walking bow-legged or you're walking knock-kneed? So that needs to be addressed. Get it fixed fast, fix the actual root cause, and then you can go forward with happier knees thereafter. Number 4, weak glutes. How are the glutes connected to your knees? They're absolutely connected to your knees. If we have weak glutes, and the majority of people do because we sit all day, when we sit all day, then our knees kind of rotate out like this because those abductors are the ones that take away the legs from the midline, get weak, they get unused, they get lazy. So if we've got weak glutes, then as we walk, we've taken away the perfect alignment where we should be walking like this, we're more walking like this. That puts more uneven wear and tear, particularly on the medial or inside aspect of the knee. That's this side here, okay? This medial aspect. So we've got angle coming down here, forcing through this area. So doing something in alignment, doing something like glute medius and glute minimus specific building. I will link to very specific, very isolating. I've got a couple videos on that. Those will be down in the description here. So that's 4. Number 5, also similar, but related. Tight quads, tight calves. Why are these important? The quads cross over the midline. So here is the femur. This is that long bone of the leg. Here is the tibia. This is the short bone in the lower extremity below the knee. Both the calves and the quads cross over and they have attachments. So calves crossing over here. So when we are weak, tight in our quads and in our calves, we actually get a wear and tear. Particularly, we talk, at this patellofemoral aspect. If this is super tight, then it's not going to allow the good flow or form of the knee cap on the groove of the femur. And so we can get some alignment, we can get some pain, wear and tear in that patellofemoral syndrome, commonly known as jumper's knee, runner's knee, etc. And the same with the calves. So we've got to do some stretching. We've got to pay attention to the calves and to the quads. So stretching is crucial. Warming up, stretching, cooling down with stretch. Number 6, allowing stiffness to rule our day. Just thinking, I'm just going to be stiff all day and I'm just going to kind of baby this joint. That's not good. We're most stiff in the morning because we've been laying in a position all night. So we get up, the joints are not warm. Think of it as a car. When you first start your car, those oils, those fluids are not moving. They're not happy. They've been sitting cold. And so it takes sometimes, think of like a diesel car in the middle of a wintry place. You need to actually sometimes plug in that car so that it starts in the morning, but then you let it run to warm up. Similarly with your body, with your joints, doing some range of motion first thing in the morning to loosen things up and get things going, taking it a full range of motion 10 times a day, just at little various times. So bending those knees completely, that can be even when you first get up, before you get out of bed, you bring your knees to your chest and then you push them back, and you bring your knees to your chest and then you push them back. Do that 10 times. Do this throughout the day. You could be standing and you bend that knee to where your heel comes towards your butt and your fully hamstring flexion, and then you extend that. If you tolerate stiffness, you're going to then change your gait. That's going to change your mechanics. That's going to then put undue wear and tear. You made it through the 6. What's the 7th that I said is a real joint killer and you need to avoid this? steroid, corticosteroid, cortisone injections. We now know and have known for quite some time, but unfortunately, because people say, well, I can buy myself a couple weeks, I can buy myself a month, and it feels better then. This is a Band-Aid. It gets in there and takes out some inflammation if there's an inflammatory cause to the knee pain. But guess what it also does? It degrades or tears down, kind of eats out like a little Pac-Man, the cartilage. The cartilage on this is the blue. So if we talk about these little pits here, that is wear and tear in the cartilage. And steroid actually does this to that cartilage. It can accelerate the loss of cartilage, accelerate your need for having a joint replacement. Who wants that? If the steroid is put elsewhere, say into the meniscus, into the collateral ligament, into the ACL, into the, name it, the bursa around, like the Pez-Anserine bursa, then it can actually lead to rupture of the tendons, rupture of the ligaments. That can then require a full-on surgery. So while you think that this Band-Aid is going to buy you 2 weeks, 4 weeks, maybe 6 weeks, it's really not doing you any good in the long term. So we've gone over 7 things to avoid so that you can have the kind of knee health that you deserve, so that you can stay active, so that you can return to activity, so that you can stay out of the operating room. If you'd like to learn more, please reach out to me, see if we can work together to keep your knees where you want them to be.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.